Record, we can get going. There you go.
Okay. Hello and good morning. I'm Leonardo McClarty. I'm the president of the Howard County Chamber of Commerce, and it's my pleasure for us to kick off today our affinity program meetings or webinars. And the whole idea behind this is to make sure that you, our members, have a better understanding of ways you can save money through your membership with the chamber. Many times there are products or services that you're purchasing anyway, and maybe you don't know that you might be able to save money on those things through your membership with the chamber. And certainly as an organization that constantly thrives to make sure that, or strives, I should say, to make sure that our members are receiving value, want to make sure that you are aware of the different programs and services that are available to you. And certainly as we all continue to deal with the effects of the coronavirus and how that's impacted our ability to come back to work and bring our employees or customers in, we want to make sure that we're doing things in the right way, that we're constantly making sure that things are safe, that we have a healthy work environment. And so with us today is Eric Middleton, who has developed an app that the Chamber is partnering with him on that's called MyHealthyWork. And the whole idea behind this is another way of employees bringing workers back safely. And so with that, if you're going to end up doing some things that you want to make sure, again, that you're monitoring your employees' temperatures and knowing who's been sitting next to whom and so forth, all of those things that we're constantly hearing about through whether it's the CDC or best practices with our respective industries. Want to make sure, again, that you know this is another way that you can continue to help your businesses. So with that, I'm going to turn things over to Eric, who's going to share with you some slides and talk to you about MyHealthyWork, and then we'll go from there. So Eric, the screen is yours.
Great. Thanks, Leonardo, and I appreciate the opportunity to present to you all today. Hopefully this will be a fairly quick conversation so you all can kind of get a look and feel of the app, see how it works, and then we can kind of talk from there. You all can also go to myhealthywork.com to go through and do. There's pricing that's there, but as Leonardo discussed, there's a discount for you all as being part of the Chamber of Commerce. So if you do hit the sales button, just make sure that you're from the sales, or you indicate that you're from the Howard County Chamber of Commerce and you're a member that's there, and then we'll apply the discount across that, which is great. So so let me get through the app here. Basically what happens is employees take their temperature at home. They answer some health related questions. We follow the CDC about 99% of the time as far as the questions go. There's one question around a low grade fever, which the doctor that helped us create the algorithm suggested that we do. We then process that information, and what we do is we tell you whether you can come to work today or you should stay at home. But if you can come to work for the day, you can then pick which office you're coming to, whether you're working in the field. And then as well, if you are actually coming to the office and you're coming into the field, what we do is we have a contact tracing system. We use QR codes, and we'll talk a little bit about how that works and who you interact with. And we'll talk about how you set that up in the app. That's something that you set up one time. So when we developed this app, we wanted something that was non-invasive, something that employees would be comfortable downloading. So it is not GPS enabled. It doesn't have Bluetooth. That way employees feel that you all are monitoring them outside of the office. It's really the only time they're using the app is when they're in the office, and it's really around scanning rooms as they enter them to figure out if there's similar employees entering those same rooms as they are. So here's what a building looks like, and I'll explain a couple of things here. So you can see that we have the QR codes on confined areas because we know that's how the virus spreads. So what we do as part of your initial setup is we help you define all these rooms and areas. So we're looking for, again, general areas, kitchen. We're looking for multi-stall bathrooms. Here we have them on an elevator shaft. So we want to be able to put QR codes on all those different areas, even single offices is what we'll do. So that's part of the initial load. That's something we help you all create. It's super easy to do. and then you can name them whatever you want to, so it's specific to the employees. And then we have another feature which is called people that you sit physically close to. And what happens, and I've drawn a couple here, is if you have open cubicle kind of areas, what you would do is, imagine I was in this bottom right hand corner, I would add the two people that are next to me, across from me, and then potentially the other row, because based on OSHA and CDC guidelines, right, it's 6 feet to 10 feet is distance, is what they're recommending if you're seated for long periods of time. So that's what you do. And then once you add those people, as they check into the office, you are automatically linked together in the contact tracing database, which is nice. So again, that's only one feature, and we'll talk a little bit of what that looks like. Here's what the employee process is. It's super simple. We ask you what your body temperature is. Again, you get to do this in the privacy of your own home. You have to fill this out every day. Then we ask how you feel. Are you healthy? Are you sick? Have you been exposed to somebody with COVID? So that means in your household or outside the office. The next one is, have you tested positive? So that's if you actually have COVID and you have in fact tested positive. They will ask you some other health related questions. Again, these are very similar, if not exact, to what the CDC has. You may fill those out. And then from there, we will give you one of two screens. So you see this big or down here. If you can go into any location, you may still opt to work from home, but we just want to know that you're feeling healthy. Here, you can pick your office location. If you have multiple offices or you want to change offices, you can do that as well. You're working in the field, you're not working today, it's a vacation time. And then the other screen you could get, depending upon what you fill out here, is we could tell you to only work from home. And we may quarantine you for a time period, and we'll talk a little bit about what that quarantine looks like. And then you'll hit a summary screen that's here. This may give you some information about your health status, around your work location, and you will also see something that we call quarantine days. So the system is constantly calculating how long you need to be at home if in fact you are quarantined. And we'll talk a little bit about what those screens look like and how that works. This is what the primary dashboard looks like. So I'll explain some of the components that are on here. So starting at the top left, here's your name. We have a notification bell. So if there are any notifications that went out, you would be able to see that information there, as well as on the email. The app is gamified, and that's really to create kind of fun for your employees, as well as other people that are using the app. So the more points you get, you can give out awards and things like that. You'll see down here, there's a leaderboard that tells who's in the lead. So there's different badges and different things like that you can use. And we know this is a change management lift for a lot of companies. So hopefully this is fun for employees. You'll see we have a color-coded dashboard. We have 4 different colors. So we have green, yellow, orange, and red. We'll talk about how you get each one of those. You'll have today's current date in there. You'll have the interactions for the day. So we'll talk a little bit about how that happens too. Again, as you enter rooms and people cross over those rooms, those people will get entered into the contact tracing database. So this is constantly changing on an employee's dashboard. There's overall company stats that are here. So who's working at home, who's in the office, or who's not. This is where you set up the QR coding is right here. You just simply click this button. We'll look at what those screen looks like. We talked about the setup of my interaction. So these are the people you sit close to or that you may interact with frequently, and how you can get them to add to your system very easily. And then on the more button, you'll find things like you can change your location. So if you start off at home and then decide to come into the office, you can do that. You can set up a personal reminder as to when you should fill this out every day. So it's what time you want to do it, and you can change your password and log out. So here are 4 different colors screens, and I'll explain how they work. So green is good, yellow means you need to take caution, orange means you need to be self-quarantine, and red means that you have COVID. So what I'll do is I'll explain it in the context of the names that are here. So Rig met with Randy and Roma met with Rig, but Roma never met with Randy. So what happens in that situation is if Randy goes COVID positive, the system in real time will notify everybody that Randy has had direct as well as indirect interaction with, that they have potentially been exposed to COVID. It will not tell them who the person is. It will only show the information about who it actually, the date that it actually happens. And then what you'll notice is the system will constantly calculate how long you need to be at home. So here you can see Rig needs to be at home for 9 days. Randy may have 7 days left, and then Roma has 4 days. To be cautious. Again, Roma can still come back into the office, but Rig and Randy cannot. So again, Rig met with Randy. So Rig's dashboard, because they had direct interaction together, we'll ask Rig to stay at home. But because Roma never met with Randy before, only met with Rig, Roma's dashboard changes to yellow because Roma did not have direct contact with Randy. So that way we can separate employees. And then as well, if somebody goes COVID exposed, if say Rig went COVID exposed, we will also notify everybody that Rig met with directly, and we will make all of those people yellow as well, because Rig in that case may have met with, his wife or somebody that's in his family that has potentially tested positive. So those folks would be yellow as well. In addition to that, we have a back-end portal. HR actually gets notified about this. There's a tree diagram that gets created that shows where the exposure is. If you have multiple offices, it shows you which offices are affected, which floors are affected in those. So the system shows you a lot of information that's there. So that's the different color changing dashboard. Again, I kind of explained the way the contact tracing system works. So when it happens, the system crawls back 14 days. It tries to find everybody that it had direct contact with, and then all of those people, it crawls back and looks at everybody that had indirect contact. If an outbreak happens, it happens in real time. So the email notifications go out to all employees impacted. I'll show you what the message looks like. And then as well, HR actually gets that information. In addition to that, they get an email. Again, they can log into the back end of the system. They have a separate portal where they can see all the employees. What's important to know is that we don't provide any health-related information to you, the employer. All we say is whether somebody has symptoms or not has symptoms. So all that information is kept private from the employer, and that's nice because then the employees, know that that information is not being shared with anybody. This is what the emails look like. So you can see here, it says someone you directly interacted with. It'll provide the date. It'll tell you what the color of your dashboard is. It'll ask you to be home quarantine, or again, this is the yellow one, which is indirectly. You can customize this message, so you can put additional information on either one of these messages, and they're independent. So you can put a different message with indirect as opposed to direct, which is nice. This is what the QR code looks like. Again, you simply pull up the QR code, you allow access. We're only interested in access to your camera, or to the camera, not to your camera roll. You'll scan that QR code. What it'll do is it'll tell you the room. These are the rooms you create. So they'll be very familiar to you all. So if you have a boardroom or something like that, or you have named rooms, it will come up for the employee. We want to know how long we're in that room. And then anybody that's in that room during the same time frame will be automatically locked in the contact tracing system and will end up on that dashboard on the interactions for the day. So that's how simple it is to do. This is where you change your password. This is on the other button. You can see here, you can simply set a reminder if you need to. So here I've set it for 8 a.m. every day. I hit OK. If I don't fill it out by that time, the system will send me an email and say, hey, please fill out your information. So it's just a reminder to folks to finish that up. The daily interaction process, if you don't have anybody that's there, there's a couple of things that you can do, which is good. So I've set up my family here, which is nice. So if I met with, Jen on a regular basis, I could put her on my favorites list. You have some that are called people that are close to me. So again, those are people that physically sit close to you. You'll notice underneath everybody's name, you'll see whether they have checked in or haven't checked in. And this is really just to allow employees to kind of make sure they're adding people correctly. Again, if they use the QR code, it's automatic. And if they set up people close to me and they check in the same office, they're automatic as well too. You can look up the employee directory. There's a bunch of filters and searches that are here. And then all you have to do is once that person's been added, they'll show up, it'll timestamp when they've been added. to the system. So it's really easy to do. Again, if you're using the QR codes or people that are close to me, it's all automatic. Your employees don't have to do anything. But let's say I met with Leonardo in the hallway. He's not somebody I meet with on a regular basis. We did not meet in a conference room. All I would do is hit that plus sign off the front. I'd hit the plus here. I'd go to the all employee directory, which is this little book. I'd find Leonardo's name and I'd simply click it, and then he's added, and then it automatically adds me to his as well. So only one person has to do it. And then if you need to remove somebody, you simply hit the X and that closes people out. Each employee has to sign a consent form. So we have a consent form. It's on our public website. And then you all as the employer get the ability to load your own privacy statement. If the employees don't consent to the system, then they don't get to use it. Either way, but you all get to load your own privacy as it relates to that, which is nice. And then what happens is it's really kind of simple after this. After we set up everybody, which takes about less than 24 hours, you all send us the information and some Excel templates. We get that loaded out. What we like to do is generally have a meeting with your employees just to kind of answer any questions, do a quick demo of the app, and then if they're on Android, they actually download it from the Play Store. If you're on an iPhone, it's actually something called a progressive web app. You add it to your phone just like an app. You'll log into the first time. You get your secret password. They do the consent form. You fill out your first health survey, and then you change your password, and you can set your daily reminder. And that's how simple it is. And then every day, the employees just use the system to make sure everybody's safe. So that's really everything there is about the app, Leonardo, which I think kind of explains everything to folks, which is good.
Excellent, Eric. Thank you for that presentation. Just a few questions I have on my end that I thought perhaps interested parties may have. So obviously you and I have talked for the better part of easily 2 or 3 months now, and I've had an opportunity to see the app further develop. And it's interesting that I could see the changes that have been made over the period of time from when it was first introduced. And so with that, one question is just kind of talk maybe a little bit about how often you're making updates, and because it's, I guess, app-based, shall I assume that it would be similar to the same way that if you bank with, whether that's PNC or Wells Fargo, or if you're a Chipotle eater and they tell you, go to the App Store and there's another update. So talk about how the updates, I guess, perhaps how often they're made, or at least how do you determine when an update is needed, and how do the end user find out that there's an update to the app?
Sure. Yeah, that's a great question. So different answers for depending upon which one you're on. So if you're on Android, we publish a new version of it. It just gets updated on your phone if you have that setting set up. So it'll just push it to the phone. On Apple, it's something called a progressive web app. And so Apple has decided that nobody can have contact tracing unless you're a government entity in the Apple Store. So it's called a progressive web app. So it's basically like a mini website is what it is. But we do update the website, and like you just don't even need to do anything with that actually. So, but you actually get a little icon on your phone, which is kind of nice. So it looks and feels exactly like an app. But what's also nice is you can fill it out from work. So if you are at work, whether you're an Android user or an Apple user, you can actually use your desktop as well, which is really nice to do. So you can simply set it up that way. But we do have a list of, and it's good that you noticed that. I appreciate that, Leonardo. We've been making changes about the app for, over the past couple months, just to kind of put in new features and put in new enhancements. Really, what we've noticed with most companies is they want a lot of customization. So you saw in the last one, that was our most recent update, is that you could customize the 2 messages, because that's what people are really kind of interested in, is like, how do I customize my message for my employees? Because I want to be able to communicate different things to different people, right? If you have indirect versus direct, we may want people to call in immediately to HR, even though that HR knows, right? Because there is the dashboard that's there. They can see all that information because they have the tree structure, which is really nice and shows all the impacted employees, which is great. But at the same time, we're hiding all the health related information, which is nice.
And speaking of customization, so obviously you've got kind of maybe the core customizations that's built in where maybe you've got two options. But let's say you have a conversation, I don't know, with a company that maybe wants even additional customizations. Is it an option for them to obviously have a separate conversation, if you will, where they might either pay some difference or something else to get those extra bells and whistles should they want it?
Yeah, absolutely. And in some cases, what we're finding, right, is we're getting more and more people on the platform. People are asking for the same things, which is how we got to the notification piece, right? So there were a couple companies that are like,
Makes
wow,
sense.
we'd really like to have that, right? And again, instead of, billing everybody, which we didn't want to do, we just said, hey, we'll roll that out because there's
Right.
multiple people. And, we still have a list of kind of, I don't know, now maybe we're on day 5, day 6 list. So we're continuing to update the system as we go through. And I think even when we come out of COVID, I mean, our belief is that, things around, employees' mental health and options around that there's going to be other questions that employers are going to ask, and different things like that, which I think is good. So we're, our goal is to constantly upgrade the system as much as possible because, we will come out of COVID and, but at the same time, we want there to be an option for the app to live on because we do believe that relationship between, employee and employer are going to change a little bit as it relates to health. I think the days of people coming in, coughing and hacking at their desk are over. And, we may not ask somebody to be at home for 14 days because that's what the CDC is requiring.
Right.
But instead, we may tell an employee like, hey, just stay at home for the day or stay at home for 2 days or different things like that. So I think that's what we're going to be looking at. But great question.
All right, excellent. So just two other short questions before we wrap things up. And so oftentimes I know you reference, for instance, HR being able to review things on the back end. Is there a limit as to, I guess, who has access to some of the background data? So whether it's HR or maybe whether it's the CFO or COO, is there any limit as to who can access some of the back end data?
Yeah, so we generally recommend that's the smallest number of people you want is really who's in the back end of the system. And I can quickly share real quick what it kind of looks like just so people kind of get an idea. And I've left one of the tree structures that are up here. Now, this is our test system. And as I've mentioned here, this is a case where Kane actually, caused the outbreak. Again, the data is a little old, but everybody here would be orange. All of these people would be yellow. You can quickly see how many people are impacted. If you went to a location within that, you could see what floors are impacted. But yeah, you would want a limited amount of people in that situation to be dealing with that. But generally, like if you're a 100-person company, we're generally finding that you probably have, 2 or 3 people have access to it. It's not the masses that are there because, you can email users if you need to, right? You can look at the location data. You can see all that information. So generally, we don't want a ton of people to have access to it, but it's
Right.
unlimited. I mean, you can create as many as you need to. And even the other thing that's nice is you can create guest accounts. So if you have somebody that's coming in for the day, you simply just add them. You can ignite an email. It sends their secret password to them. Because it's a progressive web app, they basically link to it for the first time. So even if people are having guests and things like that, they can use the app. And then, but what you would want to do is encourage those guests to, use it afterwards because, if they got COVID afterwards, or they themselves did, they could potentially affect other employees as well.
Okay. And then just the last question, I know you shared in the sense of how people would set it up by, I think you was on the last slide, but for, I guess, the company itself, how long, so they say, hey, Eric, we're interested. How long does it take to get set up? And then talk maybe a little bit about the training of, let's just say it is the HR person that's going to be responsible. How does that work in terms of them learning how to use it and setting it up and so forth?
Right. Great question. So generally for us, by the time, somebody says yes, most of the work I would say is on the employer side, right? Because we have very little information about the employee, so we just need to know first name, last name, an email, and their phone number. That's all we need, and what their primary work location is. So that's all we need. Then, as we talked about the QR codes, we need to set up those. So we go through that, and generally what happens is we send you that information. Then as well, you get the ability to load your own term sheet, right, for the employees around, their consent form. We give you we're not a law firm, but we give you a starter template. You can then use that starter template. We load all that. So I would say, let's say on Monday you said yes, we would send you the template. Let's say, a company finished it, and sent it to us Tuesday. We would have it loaded by Wednesday. And then what happens is then we would roll that out. We have a couple of videos that we can send out to people that we can link. Some cases, we've worked with some employers where, we just partner with HR. I do a presentation very similar to this, where, we might have 20 or 50 or 100 employees on the Zoom. And then I'll answer questions as they come through, but I kind of go through it. I go through the app live, just kind of answer any questions, get people comfortable with it. But I would say generally, and then we ignite the emails after that, and then all the emails go out, welcome everybody. So I think from the time, all the terms and the privacy information is done and we're loaded, you can be up and running in 24, 48 hours. Again, I think the biggest lift in most cases is that employee piece of it, letting employees know that they're going to start doing this. The goal with the app is to keep employees safe, right? We've all kept our families safe, and now we need to move that to the work location and keep everybody there safe as well. And I think that's where we are. And we're one of the few systems that have contact tracing, and we're one of the few systems that is not GPS, not Bluetooth enabled, right? Which hopefully will make employees feel a lot better about the fact that it is an employer-based app, but the employer doesn't know where they are, right? They check into a work location, but we don't know where they physically are in the building at any one time, right? We know where they've been from a QR code perspective and an interaction, but that's about it. But yeah, it's from that time, I would say about 24 to 48 hours. But in most cases, to be honest with you, it takes a little bit of time for HR to kind of get everybody locked into a meeting. So I would say,
Right.
I'm told it takes a little bit longer, and it's really just getting everybody, together on a meeting. But we send out videos and all that kind of stuff. And then we've told the HR folks, like, if, we hold generally specialized training for them, just explain the app, how it works, how they go through it. There are some amazing features that are in the back end of the system that give HR a lot of visibility into the system as well. Even once you're quarantined and your days go to 0, or an employee wants to come back, let's say they've been tested and they've been tested as negative, employees can actually come back early, and we call it unlocking them in the system. So HR can actually log in from a risk perspective, can unlock somebody once somebody's provided the results of a negative COVID test. So we're not bringing employees back to work that are quarantined in any case, whether it's through our interactions or they in fact have COVID. HR is in full control of that, which is nice. So that way they can decide when employees come back, which is great.
Excellent, excellent. Well, Eric, thank you for sharing this information with us this morning. And again, if someone is interested, I think you may have showed it earlier, but perhaps if we could either maybe do a quick screen share again. I think it was the website, and I don't know if there's or is it just as simple as MyHealthyWork.com?
Yeah, yeah. And what I'll do is I'll just pull it up here real quick. But it's MyHealthyWork.com, but let me just share here real quick. And then, yeah, the site is there. So you can see the solution. There's a pretty slick video that's out there that explains it to everybody and what the benefits are. Again, pricing is down here, but we know if you're part of the Howard County Chambers, you get off 10%, which we're not, discounting to anybody else. So that's a great benefit to you all, which is amazing. But you can just enter the number of employees, and then if you need to, you have a general inquiry or you're ready to go, you just click one of those buttons. It'll get routed to the right people. We ask you for some basic information, and then we go from there. And the other thing too is we are trying to give back to organizations. So if you're an organization that's struggling but you need the app, right, we can help you out as well too, because that's what we're trying to do. I mean, we're trying to get people to feel safe about coming back to work, and that's what's important to us. But yeah, you could just hit My Healthy Work, and
All right.
somebody will answer the call for sure. And the team is very
All right. Well, again, excellent. Well, again, Eric, thank you for sharing with us. And again, for members of the Chamber, certainly encourage you to check this out. We'll be back another week from today with another Affinity program. But again, today is about My Healthy Work, and it's about bringing your employees, as well as even if you have customers, but more importantly, it's about your employees feeling safe and that you're really looking out for their best interests as we all open our doors and try to get back to daily routines and so forth. So with that, thank you all, and see you soon.
Thank you. Appreciate it.